Assalamu alaikum. Today's lecture about ECG basics, lecture 3. We will talk today about the PR interval. In this lecture we will learn what is the ECG PR interval and how to measure the PR interval on the ECG, normal and abnormal, and we will have examples ECGs for prolonged PR interval and highlight the causes, and we will have ECGs for short PR interval like PRE-EXCITATION, WOLF-PARKINSONIAN-WHITE syndrome. The PR interval on the ECG is measured from the start of the P wave to the start of the QRS, as the example here on the right side, and it represents the time delay from the onset of atrial depolarization to the onset of the ventricular depolarization. Normally the PR interval is between 120 milliseconds up to 200 milliseconds. If we are having prolonged PR interval on the ECG, if it is more than 200 milliseconds, and it is called sometimes as first degree AV block or first degree heart block. And here is an example of prolonged PR interval on this ECG strip. Here is the P wave and here is the QRS complex, and if we look from the start of the P wave to the start of the QRS complex, it is about here 8 small squares, and each square is 40 milliseconds, as from the last lecture we learned. So now 8 multiplied by 40 milliseconds, so in this example PR interval is about 320 milliseconds, and now it's prolonged more than 200 milliseconds. And here is another example for measurement of PR interval from the start of the P wave to the start of the QRS complex, and here in this example it's about 7 small squares. Here is a large square of having 5, and here is another 2 small squares, and here 7 multiplied by 40 milliseconds, so it is 280 milliseconds. So this is another example of prolonged PR interval. Pathophysiology, the atrioventricular node, the AV node, is an only normal electrical connection between the atria and the ventricle. The AV node has a rich autonomic innervation which affects the time required for the impulse to pass through the AV node. Regarding the common causes of prolonged PR interval or common causes for first degree heart block, it may be degenerative intrinsic AV node disease, it may be enhanced vagal tone like athletic heart, and it may be myocardial infarction, especially the inferior myocardial infarction, myocarditis, electrolyte disturbance like hypokalemia, hypomagnesemia, and drugs, common drugs like beta blockers, verapamil, diltiazem, magnesium, digoxin, and some antiarrhythmic drugs like class 1A and 1C and class 3 drugs may cause prolongation of the PR interval affecting the AV node. And there is other causes for prolongation of PR interval like infectious disease, some like infective endocarditis, diphtheria, rheumatic fever, Chagas disease, tuberculosis, also connective tissue disease like rheumatoid arthritis, systemic lupus erythematosus, and scleroderma, and it may be iatrogenic after cardiac surgery, catheter ablation, and 2% after ASG and blood closure, and it may be transient during adenosine stress testing and right heart catheterization. The other abnormality of the PR interval is short PR interval or pre-excitation. and if it's associated with arrhythmia, WOLF-PARKINSONIAN-WHITE syndrome name became. A short PR interval occur if there is an accessory pathway bypassing the AV node. Accessory pathway is an anomalous pathway that connects the atria and the ventricle bypassing the AV node. So if this is present, like the image here on the right side, seeing this accessory pathway as an illustration, in the ECG it would be reflected as a shortening of the PR interval, as there would be appearance of a delta wave, new wave appear here, a slurring in the start of the QRS. Okay, and here PR interval shortened to be less than 120 milliseconds. In this illustration, the dotted lines represents how the PR interval and the QRS would look without pre-excitation of the ventricle through the accessory pathway, and the red line here represents the delta wave, and the ECG on the right here is an example of pre-excitation with short PR interval less than 120 milliseconds, and here is the delta wave, slurring of the QRS, initial slurring of the QRS. And you can also notice here that the QRS duration is widened in the presence of the pre-excitation compared to the normal one. So, as summary here in this slide, the WOLF-PARKINSONIAN-WHITE syndrome shows short PR interval less than 120 milliseconds and shows wide QRS duration more than 120 milliseconds and slurred upstroke of the QRS complex, the delta wave. Okay, and this accessory pathway predisposed to tachycardia. This accessory pathway may predispose to orthodromic tachycardia, narrow complex AVRT, or antidromic if it goes down through the accessory pathway, wide complex AVRT. And thank you. I hope this lecture would give you some help in the future, inshallah.